Good evening, everyone, and welcome to our eReferrals to Sydney LHD and Southeastern Sydney LHD webinar. My name is Bradley Ovian, the Acting Team Leader of Digital Health and Quality Improvement here at SESLHD, and also with us here today from SESLHD is Lawrence Thomas, our CPD Programme Officer. I would like to start by acknowledging the traditional custodians and sovereign people of the lands across which we work, and I recognise the continuing connection to land, water and community, and pay respect to elders past, present and emerging. I'd also extend that respect to any Aboriginal colleagues who may be joining us tonight. Without further ado, I'd like to introduce our first speaker for the night, Paul Bennett, the Programme Manager of Health Pathways Sydney and the Sydney LHD eReferral project. And joining Paul is Lauren Walker, who is a project officer from the Health Pathways Sydney team. Paul will discuss the HealthLink homepage from BP, MD and Genie perspective, Sydney LHD services across Engage Outpatients and RMS Lite, and also how to complete a HealthLink smart form. Our second speaker will be Kristen Murray from the Engage Outpatients Site Change Manager at SESLHD LHD. Kristen will be joined by Aaron Subhag, who is the Southeastern Sydney Engage Outpatients Digital Project Manager, and Daniel McGee, who is an advanced trainee cardiologist at the Prince of Wales Hospital. They will be providing an overview of the current eReferral system, the benefits which is brought so far, as well as the expansion plans across the region, new services including the virtual fracture clinic and rapid access cardio clinic, and reinforcing the use of referrals. And I'll just hand over to Paul now to carry on the presentation. Thanks, Paul.
Thank you very much, Bradley. Good evening, everyone. And I too would like to pay my respects to the traditional landowners in which we're all meeting this evening. Thank you very much. I will just share my screen. So, eReferral. So there's a lot to kind of cram in this short space and a lot to update you with that's happened over the last couple of years, not only for Sydney Local Health District, but for Southeastern Sydney Local Health District. So I'm talking from the perspective of Sydney LHD in the first instance, and just to refresh you all, that's hospitals such as Royal Prince Alfred, Concord, Canterbury, etc. So I will just bear with me as I advance my screen. So HealthLink. So how to find HealthLink. HealthLink is available on nearly all general practice software, so Medical Director Best Practice and Genie is the main three, including ZMed, specialist software for specialists, and a number of others that are available. For Sydney Local Health District, the majority of practices are using Medical Director and Best Practice. For those of you that are using Best Practice, HealthLink functions are simple and easy to find. They are part of your system setup, your top bar within your patient record system. So to access it, you bring in your relevant patient and locate then across the top bar that HealthLink button. That will take you to what we call the HealthLink homepage, and from there then you'll be able to select your services. In a few minutes I'll actually do a run through of what happens on the HealthLink homepage and the processes there. You should also note that within your software you can park referrals, and we'll talk a little bit more in details. And if you see on the screen, there's some brief instructions of how you view parked referrals, and again about looking at your records for submitted eReferrals. As I said, this will be recorded and all the slides will be available as part of that recording. So for best practice, it is simply a case of hitting the HealthLink button to take you to the HealthLink so for Genie, it's via the tools function and then to the HealthLink online, and that will then again take you through to the next screen where you click new, and that'll take you through to the HealthLink homepage. So it's more of a three-click process to go there. You can also view your parked referrals, and then a summary then of your submitted referrals that have gone through to the hospital services. And then with me, for medical director, it is the case they also have a health link function. This is in medical director 3 or clinical. A case of just hitting that bar, and then you hit new form as the second button from there. But what you will see with medical director is a list of all those submitted referrals for that particular patient via health link on then the various departments that you sent them to. Again, you can go back in and pull an unfinished referral or a parked referral by simply going into the health link function and double clicking on that parked referral, and through a similar way then using the letters tab function, and you can view previously submitted referrals from there. Little bit about what happens now when you get to the HealthLink homepage. You will have various different services available down in referred services. This is very much a local summary of what's there. Some of you may be able to see Northern Sydney services, Northern Sydney LHD, as well as a range of private providers and Roads and Maritime, and of course My Aged Care. For Sydney Local Health District, we have 2 entry points from the HealthLink homepage. In the first instance, we have Sydney Local Health District Services, and I'll tell you a bit more about them in a moment. And the other side to that then is Sydney Local Health District Women's Health and RPA Gastroenterology Services, and I'll explain why there's the 2 sections there. And it's a case then you click on that service provider, and that will then take you through to a bespoke list of services and into that folder. So in regards of Sydney Local Health District services, currently you can use HealthLink eReferral or smart forms to all of these services. So that's Balmain, Canterbury, Community Health Services, Concord, RPA, and our virtual services for COVID monitoring, our virtual fracture service, and our wound care command center. That makes up around about 70% of the district's ambulatory care services. There are a few services missing, such as neurology and RPA, etc. But over the next 4 months, all of those highlighted services under RPA will be moving to the other folder. The only change that you will notice as a referring GP is which folder to access, but there will be lots of signposts and promotion about when that change happens at the end of May. As we bring on more, we move those services across. A lot of those missing services, particularly at RPA, such as neurology, neurosurgery, etc., will be brought onto eReferral for the first time. So, as I said, those services in yellow will be migrating across to the other container on your HealthLink homepage at the end of May. And the plan is then for the rest of those services at Concord, Canterbury, etc., to move across at the back end of 2025 and the first quarter of 2026. So just on those other services, that'll migrate across with a rename to Sydney Local Health or Sydney LHD Women's Health and Royal Prince Alfred Hospital Services. Within that container, you will currently be able to access the following referrals. So that's all antenatal and maternity services at Canterbury, midwifery group practice at Concord, and all of the other women's health services at RPA, plus our gastroenterology, liver, IBD, and rapid access colonoscopy for a positive FOBT service. Like I said, this service bucket will be greatly expanded by the end of this month. And the reason for why we're doing that is we're changing the receiving platform coming into Sydney Local Health District to give a better user experience, not only for the general practitioners launching referrals, but also with patient communication and notifications on the progress of their referral, and better recording and governance on the hospital side from there. So what I'm going to do now is just walk you through an eReferral. So the eReferral I've chosen is going to be gastroenterology. So when you go into the HealthLink homepage, you search for your local health district and or facility. When you click onto that service, it'll bring you up with a list of the available services that you can refer to. So in this instance, we're going to refer to gastroenterology. So it is a simple click process of locating the service type that you want. For gastroenterology, at this point, it's just Royal Prince Alfred Hospital. But when Concord comes on board, there you will have the choice between RPA or Concord hospitals. And that'll be the same for as many service providers that you have within your district setup. So you simply click on the facility you want and then move across and press continue. That just takes a moment, and it's always a longer moment in the demonstration site than in the real world when this is connected to your practice software. Just wait for the form to open. Now, the nice thing about HealthLink smart forms is that they all follow a similar process. Over on the left of the screen, there are 6 tabs. The main ones to focus on is tab 1, which is requested information. Now, as this is a demo site, there will be some kind of, some of the functions won't work like the reach out to our directory function. In the real world, you get the option to just refer to and make an anonymous referral to an unknown specialist, or by clicking that list, you will get an up-to-date and live list of all the applicable specialists at that practice setting. So you can choose your doctor based on relationships, historical knowledge, or their subspecialties, preferences, etc. So following that, you are then kind of told to go down. About 60% of the information will auto-populate from your practice software, but it's always worth checking that what feeds across is accurate and correct. So referral date will be an automatic pickup. You have the option of making this as a brand new referral or continuation if this is a 12-month or 18-month follow-up. We'll just leave this as a new referral period. You can specify whether it's a 12-month or indefinite. We have 3 months on there for our tertiary specialist referrals as well. You do get the option of specifying a priority. Obviously, the specialists have the right to override that based on the clinical information that's been provided. So, and you can specify whether this is a rapid access or urgent, semi-urgent, etc. But obviously that will be appraised and communicated back to you about urgency. There are some key things that help in scheduling appointments as early as possible. So is the patient available at short notice? Is the patient suitable for virtual care? It doesn't mean that all their appointments will be virtual, and in fact we tend to prefer to have face-to-face with most of our initial consults anyway. Third-party compensable, that is a standard question that's there and doesn't necessarily relate to the reason you're referring. On all your eReferral smart forms, you will see an active link to the relevant health pathway content, and the links embedded here will take you straight through to the relevant either clinical health pathway or to the group. So in this instance, it would take you through to the gastroenterology section on Health Pathways Sydney. You will not need to undertake any login to get to that health pathway site via this means. Reason for referral. Most referral smart forms just have a blank box, and that allows you to paint that clinical picture. You can browse your consultation notes from your practice software, and you can copy and paste into that reason for referral, and it goes up to about 4,000 characters. So there is plenty of capacity for painting that clinical picture and providing evidence for triage. You've also got a similar size box and for additional referral information that you want to add about other conditions, types, etc. Next, we have questions about next of kin, primary carer. If they're set up right in your practice software, they will auto-populate, but it's always worth checking with your patient that they're still valid. The option there is to let us know if an interpreter is required. If you click yes, then let us know the preferred language so we can organize translation services, interpreters for first appointments. Special needs disabilities, this would be useful to bear in mind if there's any sensory loss, patient wheelchair, etc., just to make it that bit easier for scheduling first appointments. And there is a question here now that's standard on all the New South Wales forms, and that's about are there any risks or barriers? And this has been added as standard in all the forms, but it's also particularly useful for services that are working out in the community, etc. And we do also now ask for patient consent on these newer forms, that the patient consents to be referred to the hospital. You've got your vital signs. They hopefully will come across from your practice software if you've got them entered in the right spots there. If not, you can just free text those in, but remember to press save when you are free texting them in. The next most important thing then is about pathology radiology results. So you move across to attachments and reports. Now, this one will do a pull of the last 6 to 12 months reports that are in your patient record. You can upload documents from your desktop or from other local files you may have in your practice. So if the patient has just come in with a paper version of a radiology report and your front desk has just scanned it in, you can drag it across that way if it's not yet made it into your practice software. You can decide if you want to send all of those or just the selective and pertinent ones for that referral. What is interesting is we do know that particularly for radiology, some of the reports that come across to yourselves don't necessarily have a full list of patient identifiers. So it is just worth checking that what is coming across is relevant for that patient as part of the package. It's also worth just checking, particularly with some of the radiology ones, that they are a compliant file. Occasionally we get some file types and it won't allow you to fire that referral off. So if you ever get to the stage where you're pressing send and it's not going anywhere, you get a message to say that it's failed to go. Just always come back and just check that your file type is compliant with that. Next, medications and allergies. This will bring across anything that you've got in your medical record as being as regular prescriptions or ad hoc prescriptions. And again, you can decide what's relevant to add to that referral form. And always worth just checking that, they're all still compatible and doses you haven't changed or none of them have changed since last prescribed. Medical warnings and allergies will come up at the bottom there. medical, social, family history. Again, what's relevant for the referral is a carpal tunnel release 4 years ago relevant for someone with upper respiratory tract infection? Probably not. So you can kind of decide what's best to come across as part of that referral, and past history, etc. Family history is also relevant there as well, particularly in case of genetics and chronic disease and the pediatrics side of it. Moving down, patient information. If your patient record in your medical software is up to date, then this will pull across automatically. It's always worth that the Medicare expiry date is right. It tends to be one of the things that flags up or will kind of say, hey, we can't send the referral. So just always have a quick check on that. But you will get alerts to say this has been, this information is missing. Move down, we have questions then about Indigenous status, gender identity, and country of birth, etc. All of that should pull across from your practice software. Next of kin, that should pull across when you do the carer information. And then refer information, because you've logged in through your practice software, this will be an automatic completion as well, because to get to this, you have to be already logged in as you into your practice software. So those are the main areas to check as you complete a referral. And the most important one is requested information. So you're painting that clinical picture, and to make sure that you have attached those relevant pathology, radiology reports, etc. from there. Once you've completed the referral, it is then a simple case of pressing submit, and you'll get an acknowledgement message then, usually within about 5 to 10 seconds, saying that it's compliant, everything's been completed, and it has been sent to its destination via the HealthLink system. You can choose to just preview to make sure that you have got everything completed on your view, or if you are undertaking the referral in anticipation of results coming back in the next day or so, you can actually park that referral, so you could do all of the groundwork with painting the clinical picture, etc. And then once you've got the results to confirm that you need to make the referral, you can pull it from your unparked list, as I mentioned earlier, and then just press submit from there. I'm not going to press submit because it'll go around in circles for us. So talked about updating an eReferral. So some of you have already been using eReferral for quite some time, particularly to Sydney Local Health District, may know that if we actually put a request in for an updated referral, it would mean completing a fresh referral, very much abridged, to kind of provide us with that additional information. So whether that is pathology report or changes in the clinical picture, and it's not been an ideal process. So what we are introducing, and South East Sydney already have in place, is the ability now from your HealthLink homepage, from the patient's record, to update any referral that's still currently in flight. And what I mean by in flight, it means that it is still awaiting a triage decision and has not been closed off, cancelled, accepted at the hospital side. From there, it is a simple process, and you can see on here I've indicated the 2 areas where you can use this update function now, and that's the South East Sydney LHD referrals, and to that small but growing select group over at Sydney LHD. So within your patient record, you go to your HealthLink homepage, select update referrals. And there you can actually not only check on the status, has it been completed, etc. Is it still awaiting triage? is awaiting information back from the practice to be able to enable triage. So you will see a list for that patient. The list goes back 6 months. So you may see that there, for some patients, they have had multiple referrals to various services, and you'll see that long list there. You will see, and I'll just kind of circle, you can see that this referral there for John Smith remains in triage. This other one here for him is still in received state, so hasn't been processed. We've got here referral process. That means that you can't do any further updates to that. If you are in that situation where you do need to make changes to a process referral, you've got 2 options. You can contact the service and discuss whether they can reopen that referral, or it's just as quick to actually just send a second referral in for that. So when you're updating referral, you select the one that you want to update. You click on the little notepad and pen icon, and then that'll give you the ability then to go in and add additional information. So you'll see in this bottom screen here, are you asking for a review of priority? So that would be useful if the original notion was the patient could wait, say, up to 6 months, but there's a deterioration in the patient, so you could use this function to ask for a review and to be reprioritized. It could be to respond to information requested, i.e. that's the service saying we'd like additional pathology, or can you please send radiology results, etc. You can use this function to actually cancel a referral if the patient has indicated that the referral is no longer required. And there is another, and you can enter some notes and copy some notes over from your record system there to kind of paint the picture. And again, it is the simple case of pressing submit, and then that will come through to the hospital service and be screened and triaged. Everything that comes through does connect to the original referral, either if it's still in flight in the triaging process, or later in the upload to the medical records system. And just a little bit more, and that's about updates. So not only can you see them in that update feature, you will also get a log of them within the patient record. So in best practice, you'll see that in correspondence in Genie in the correspondence log, and in the holding file under correspondence medical director. For those of you that don't have a compatible software, I should point out you can use the MyHealthLink portal. The main difference with the MyHealthLink portal is the fact that you have to kind of number crunch everything into it. There's no automatic pull from any software systems out there on that. And I'm now going to hand over to Kristen and Arun from Southeast Sydney. Thank you very much.
Thank you, everybody. My name's Kristen. I'm one of the change managers for the Engage Outpatients project at Southeastern, and I'm here along with Arun Sabag, who is the project manager for Engage Outpatients at Southeastern also. Firstly, I would really like to thank referrers for their engagement and willingness with this change that we've embarked on with this new approach with the referral process, and how we've implemented eReferrals across Southeastern, and I'm sure Sydney Local Health District also. We've come a long way since we commenced the pilot at Prince of Wales in November 2023, and we are seeing quite a significant number of referrers coming on board regularly on a daily basis. So it's really good to see those figures increasing. To date, since November, we've received over 18,600 e-referral submissions, which is fantastic and a huge achievement considering in such a short period of time. The Royal Women's is doing exceptionally well with 84.5% e-referral submissions, so they're doing exceptionally. Sutherland is 68% submissions, Prince of Wales is about 52%, so there is definitely room for movement. The biggest impact, I believe, that the eReferral process is the timeframes whereby referrals are being processed. We've seen 71% of the referrals that across the current live services using this functionality are being processed in 7 days or less. So it's definitely a significant improvement in regards to those paper-based referrals, which would take significantly longer. At Southeastern, we are trying to move away from those paper-based referral pathways, and we're really encouraging eReferrals is our preferred method across the services that we do currently have live. So the services that we currently are accepting electronic referrals is Prince of Wales, and we have 28 services that we're accepting and is the preferred method. And as you can see, there's quite a substantial number of services here. You've got gastroenterology, you've got dermatology, aged care, to name a few. We also, at Sutherland Hospital, we're in the centralised outpatients department where there's 8 services accepting electronic referrals. And the Royal Hospital for Women, we're in the 5 major services at the Royal. We've had some really positive feedback in regards to the electronic referral process, in regards to how simple and easy and efficient this system is from referrers. So we're really looking to get your engagement so we can increase those eReferral submissions. But it's been really positive hearing that it is so easy to use and being able to provide that the information quite readily, as Paul demonstrated. It's there at your fingertips within your practice software system. So I'll just hand you over to Arun, and he's going to go through our Southeastern expansion plan for this year.
Thanks, Kristen. So just as a recap, we implemented a pilot at the end of 2023 in November, and that gave us some impetus to move ahead, and we rolled out those other clinics that Kristen mentioned in the early slide in 2024. And now we've got approval to expand further into 2025. In terms of our plan, so we're calling it stage 3 or phase 3. So the first half of this year, we intend to go into all ophthalmology services, including Sydney Hand Clinic, tuberculosis chest clinic across the LHD, St. George centralised the outpatient department, which includes 19 specialties, St. George respiratory, St. George aged care, and the ambulatory care at St. George. Approximately from July onwards, towards the end of the year, our plan right now at this point in time is to go into Prince of Wales Kidney Care, Prince of Wales Urology, Neurology, Prince of Wales Cancer Care, and then going into St. George Selected Services, and also from to Sutherland into Selective Services too. So phase 3 will be defined and confirmed in the second half of the year, but that is our initial plan at this point in time. Kristen, thank you. Do you want to cover this slide off?
Yep, I can definitely. Just a few things that touch points and issues that within HealthLink we just wanted to bring to your attention. You may or may not be aware of. We have communicated through webinars during last year and through the PHN, but I just wanted to bring these to your attention as referrers. The first one being main surgery. If you are as a referrer are practicing across multiple practices, it defaults your primary location to main surgery, so therefore not providing that unique identifier where that referral originated from. So it can lead to some inaccuracies when collecting the data around the referrer's practice name or the organisation. So there is a QRG which HealthLink have put together in regards to how we can troubleshoot with this update, and that will be provided to you a part of when this slide pack is shared. The second one was and Paul touched on this in the presentation, previous presentation, is in regards to the patient identifiers. There's some really important information that can be found in the header and footer that's attached when you send those investigations through. And we have found if in your practice software, the settings or the preferences are not set up with that functionality to include the header and footer, there is the lack of that patient identifiers being found. So it could present a significant clinical risk, but would involve a delay processing that referral, because we may need that information to determine the to clinically triage appropriately. So we may need to go back and communicate with you if there's any further information surrounding that. So again, there is a QRG surrounding this in how you would update this in your practice software to enable those header and footers. Again, Paul did touch on this also in regards to attaching as much relevant investigations as possible. This does expedite the referral process and the triage process. At times, if there is insufficient investigations provided, it does delay the possibility of processing that referral further. And therefore, we have to have that back and forth communication to get the correct information to move that referral forward. So we do ask, if you have that relevant information and is applicable to that referral, we do ask that you do provide that at the onset of that referral to expedite that referral pathway. So now just on to a few new services that I just wanted to bring your attention to. So the Prince of Wales Fracture Clinic is now offering an additional model of care, and we're offering a virtual fracture service. We will be the process is referring in is exactly the same when you would choose Prince of Wales, and you would still select the fracture service. However, if that referral qualifies and meets the criteria for the virtual fracture service, then that will be offered to your patient. So therefore, it's alleviating that ED pressure, it's enhancing that patient experience and the efficiency of the existing fracture service. There is a scenario that I was speaking to the physiotherapy today where a referral was received yesterday morning electronically and was processed and triaged, and the patient had their virtual fraction appointment in the afternoon. So it's quite a great example in how we're trying to improve that patient experience with this new service and offering this new model of care. Now we're on to a really quite brand new service that we're on offer at Prince of Wales. We have the Prince of Wales Rapid Access Cardiac Clinic, and I'm going to hand you over to Dr. Daniel McGee, who is an advanced trainee cardiologist, who will give you a little bit of feedback in regards to this new clinic that came on board last week.
Yeah, hello, thanks, Kirsten. So I'm Dan McGee. I'm one of the cardiology advanced trainees here at Prince of Wales Hospital. Thank you for the opportunity to speak, and thank you for coming here tonight. So really, we just started a rapid access cardiac clinic in the last 3 weeks, and up until last Wednesday, this service was basically just from ED referrals, but we're now open to GP referrals as well. So the whole idea of this clinic is to provide rapid access to a cardiology service here at Prince of Wales Hospital for patients who are in the SESLHD local health area district, or who are known to a Prince of Wales a cardiologist. The idea is that the patients who are to be referred are patients who are low to intermediate risk, and the classic example would be low to intermediate risk chest pain, low risk syncope, new heart failure, not needing oxygen, or new atrial fibrillation, which is hemodynamically stable and not needing sort of an ED sort of level of care.